I would like you to know that cholinergic side effect is exactly the opposite of the flight response. So what is a flight response? That is the response because of increased adrenaline or noradrenaline that drive. When does it happen? How to remember it? When a dog chases us, what is the response? That is the flight response. The opposite of that is the cholinergic symptoms. So what are the cholinergic effects? First one is diarrhea. So when a dog chases us, we don't want diarrhea to happen, right? When a dog chases us, we don't want to urinate. That urge, we don't want it. We don't want meiosis to happen. We want the eye to allow as much of light as possible so that we can gauge the space, get oriented to it and flee away from it. So the meiosis is a side effect of cholinergic. What about the heart rate? We want the heart rate to increase. The opposite is bradycardia, which happens in cholinergic side effects. How about the lungs? The lungs are supposed to allow as much of oxygen or air possible. So therefore we don't want bronchospasm to happen during flight response. So bronchospasm is the opposite of that, which is a side effect of a cholinergic. Excitation. This is a side effect of a cholinergic symptom. And lacrimation. Again, we don't want our eyes to lacrimate during flight response. Salivation, we don't want salivation, but sweating is a side effect of a cholinergic. So these are the side effects of cholinergic. Exact opposite is what happens in anticholinergic. A small note about antipsychotics too. What does antipsychotics do? Antipsychotics will decrease the dopamine levels. So this is the base level, that is it decreases the dopamine. We need to know this. So just by decreasing the dopamine, it exerts its antipsychotic levels. But we have a very fine balance between the dopamine and acetylcholine. When the dopamine increases, then the acetylcholine increases. I mean, when the dopamine decreases, the acetylcholine increases, because that balance is not there. Because antipsychotics are going to decrease the dopamine. The dopamine will keep the acetylcholine in check, or there is a fine balance between dopamine and acetylcholine. When we give a medicine to decrease the dopamine levels, then the acetylcholine levels increase. So this is what is seen in antipsychotics. So mostly the side effects of antipsychotics will be cholinergic side effects because of this mechanism of action, that is decreased dopamine, increased cholinergic, and any of these. So this is in short about the cholinergic side effects as well as the antipsychotics and the mnemonic to remember it. Thank you for listening all this while. All the best for your exams.